mortality and infection rate. Next, I give the floor to Professor Peter Herman. He has an academic background in sociology, economics, political science, philosophy, and law, and had been actively involved in EU policymaking, engaging for the rights of disadvantaged groups. Currently, he is research fellow at the Human Rights Center, School of Law, Central South University in Changsha, and member of the European Academy of Science and Arts. Professor Herman, please.
Well, thank you very much for the opportunity to address this assembly. And I would like actually to talk to more people, to address more people, because it is really a global issue we are talking about. And everybody of every way of life should be aware of the issues we are tackling here. I suppose that there are three major issues that need to be highlighted when discussing the pandemic crisis. And after this, it should be clear that we are actually not facing a crisis of a virus. First, to the best of my knowledge, the origin of the virus is not entirely clear. It seems to be clear that geographically it originated in China, or to be more precise, in the province of Wuhan. While there had been some doubts even on this point, it is useless to discuss this issue, as the question of the origin is not really a geographical issue. At stake is the definition of humankind in relation to nature, of which we all are part. It is a matter of balancing. We may actually redefine sustainability as matter not only, and perhaps not even primarily, as perspective of time, but also importantly as a relation of changing quantitatively and qualitatively natural forces. Traditionally, we would probably speak of the relationship between man and nature. However, it is necessary to emphasize that human beings are part and parcel of nature, and various aspects need to be considered when we are discussing the relationship between different forces. Human beings only representing one of the forces in the complex relationship. It is basic knowledge, for instance, in forestry and agriculture, that there is principally nothing that is as such occurring too much or too little. Instead, the question is always one that is concerned with the relationship between different elements. There's not too much or too little water. The question is always one of appropriateness. Some plants need much, some little. Broad river beds can cope with much water at a time, narrow ones obviously not. This should be taken as a point of reference when it comes to investigation of the origin of the virus. Of course, this cannot be undertaken in this little time I have, and it is also not really my expert knowledge in details of chemistry, of biology, of virology. Still, I dare to say that we see already for the long time the center-periphery relationship as outlined in world systems theory, and not least in the special case of dependency theory, clearly showing this as well as the imbalance of natural forces, while the so-called developed countries are actually per capita the worst. When it comes to, for instance, to CO2 emission, the conditions are favorable when it comes to distribution across space. Although urbanization is a global phenomenon, it is especially virulent in those the so-called developing countries or threshold countries, resulting for different reasons in the emergence of megacities. Often pools of poverty, these spaces are especially prone to the development of diseases. In other words, talking about the origin of the virus must take into account that the working and living conditions are in actual fact not least result of global politics. And though the virus originated in China, as it is said, it has to be emphasized that it is in actual fact increasingly or part of this independence of the interdependence and the center countries forcing certain politics on China. Fortunately, there is a way now over the recent years of emancipation that is allowing China in particular getting out of this loop. In any case, major problems persist and need to be addressed. We may look at the African continent, South America, and also parts of Asia. Second, again, there are various points that require detailed analysis. Nevertheless, bottom line is that spread and severeness is not simply a biological phenomenon, but one of the general health conditions, here meant as the general living conditions, allowing developing healthy lifestyles. This includes accommodation, working conditions, microclimate, general health, medical provisions, and others. Due to conditions imposed by the centers of the imperialist world economy, we find especially that in the countries of the periphery, such conditions cannot be provided. It is worthwhile to add that we find in the poor countries, again, replication of the center-periphery patterns. And we should not forget that these patterns are also prevalent in the so-called developed countries, and increasingly so. When we look in this perspective at the vaccination, we see that the need for vaccination is different according to the local conditions. While it is a global threat, definitely, in principle, not knowing any spatial or social borders, we see that at the end, such statement needs to be qualified. Third, in the current debate, most important, we face the problem of private control of the production and via price of the distribution of the serum. In addition, it is by and large not regulated, or even worse, regulated in a way that does not reflect the global inequality. Justice, in actual fact, requires the recognition of inequality. Especially the poorest countries and the poorest strata of the populations are, due to the living and working conditions, in need of more and more of the vaccine. This is the essence of what had been said earlier. And I want to emphasize and appreciate what China does in this respect of sharing responsibility, of taking responsibility to distribute the serum to the poorer countries. This means as well that vaccination must consider, as said, the need of unequal distribution. Currently, we see that the pharmaceutical companies are actually in a position to conclude adhesion contracts, imposing their own conditions without any humanitarian considerations on governments. This is a future of costs in the global perspective, not only money, but also lives. This goes without any further explanation. To conclude, we are witnessing a situation where the COVID-19 crisis turns out to be a crisis of imperialist policies, enforcing disproportionate relations of natural forces, leading to inequality of the conditions to face diseases, and also to inequalities to handle them. Exploiting the countries of the global south evokes, at least in the responsibility of the exploiters, to support them during this global pandemics. Otherwise, the result will be shown as a boomerang effect, making it also for the global north difficult to find an answer, and for all of us difficult or even impossible to escape this deadly circle. Thank you very much.
Thank you, Professor Herman. He analyzed the relation between human being and nature and pointed out that poor countries need more vaccines. The pharmaceutical companies should be more humanitarian and not just for making money. Developed countries should bear more responsibilities to help developing countries cope with COVID-19. Dr. Steiner, thank you. And we're glad to have Professor Herman back with us again. Professor, there's a question addressed to you. Let me read it. Professor Peter Herman, your viewpoints are very enlightening. You mentioned that global North countries should take their responsibilities to support global South countries during the pandemic. Can you be more specific on how or what global North countries should do to assist the global South countries? Professor, the floor is yours.
Well, thank you for the question. And indeed, it is, as the previous speaker said, a very complex issue. I want to focus on four things and just call out the kind of headlines. First, the vaccination has to be a matter of public or publicly controlled production. This is currently not the case in at least the European and countries and Northern America. This is crucial for the supply with the vaccine, not least because via the control of prices, there is as well the inequality and sometimes even countries' government. Okay, now I don't know where.
Oh, great.
Where
You're back.
Interrupted. So vaccination as a public production, publicly controlled, acceptance of the emancipation of these countries, developing countries, global south countries, whichever term you want to use. Embargoes are deadly as well, and it has to be stopped wherever. And it is not only strict embargoes, but it is as well the policy against China in particular, with the hostility when it comes to international policies and trade policies. Health is a public good, and this has to be accepted. We can't go on with this privatization of health sectors. And if it is a matter of property is the one thing, but it at least has to be controlled as a public good. And finally, the World Health Organization is still working, and I say still working because there is a lack of influence of this organization, not least because private foundations take over and have a strong role in financing and in terms of policy making. We need, and this is crucial, we need public health systems and not only short-term oriented policies. And this is what private foundations want, short-termism, profit-making as well from the health sector. This has to be stopped, and this is not least the task of the World Health Organization. I'll leave it there.
Thank you, Professor Herman. I think a good answer always worth waiting. Thank you.